All right, guys, so in this video, we're going to do tracheostomy care. And I'm going to show you how to do trach care with a cannula that goes in. We wash, if it's in the patient, we will take it out, wash it, and put it back in, as well as we are going to look at what it means to do trach care on a patient who has a disposable inner cannula. So first, we're going to start with a patient who has a cannula that needs to come out, be washed, and put back in. That's more complicated. So we'll start with that one first. So when you come in to see your patient, of course, you're going to want to bring any necessary equipment. You're going to need a tracheostomy care kit. You're going to need hydrogen peroxide and either sterile water or sterile saline. You're going to need a mask. You're going to need your trach holder, okay, which you have in your bag. And then if it's a disposable inner cannula, you'll need to get a disposable inner cannula. We would adjust the bed. We'd put the side rail down so that we can be at a good working height, knowing that some of this procedure is sterile, but most of the point of doing trach care is that we don't introduce new microorganisms into the patient's system. Once we pull the inner cannula out of the trach, we're contaminating our sterile field with that, but it's only contaminated with the patient's own microorganisms. So we're of course going to do hand hygiene. We're going to identify our patient, close the gown or close the curtain, make sure that we talk with them, tell them what we're doing. If they are having any pain, if it's a new trach, they might need some pain medication before we go cleaning around that area, versus if it's an old trach, they might not need pain medication. You will, of course, talk to them throughout, making sure that they understand what you're doing, regardless if they're awake and alert. You'll make sure that you have a garbage can nearby to drop stuff in when you're done with it. Then we will go ahead and you can put the face shield on now. If you're going right from suctioning, just leave it on. So if we had just finished suctioning, we would still have this on. Our patient would still be being hyperoxygenated on the wall, so we wouldn't need to do those steps. So just try to go through that flow when you're practicing for your comp, because that's how it's going to be. You're going to need to provide trach care and suctioning to your patient. Okay? If we didn't take out the soil dressing when we were doing suctioning, you would put on some sterile gloves now and go ahead and remove this dressing underneath. As well as you can go ahead and unsnap that trach collar if you snapped it back up after suctioning. Anytime you're pulling dressings from underneath this, stabilize the face plate, which is the clear part next to the trach, to make sure that you're not providing too much movement on that trach. So we would take that off. We have our oxygen where we want it. We're hyperoxygenating them. We can go ahead and take our gloves off. And again, remember, if you don't have anything sterile set up here, you're going to go ahead and do hand hygiene in between anytime you take your gloves off, because it's wash, glove, wash. So what we want to do then is now set up our trach care kit. So this is going to be sterile, so we want to be somewhat ready for that. We want to be cautious when we're opening it, just kind of pulling from the edge. You can go and make sure that you get this open enough that that doesn't close back down on you. When you open it, this is what it's going to look like. There's going to be this little basin that you can pull out. There's a little tab here. You have to reach in carefully and grab that so as to not contaminate the rest of the items. You're going to go ahead and pull that out. That's where all your sterile items are going to be. There's also this in here. You can use this not as a sterile field, but you can use it to put it on your patient's chest if you want to gather secretions, or sometimes nurses put it across the chest, and then as they're cleaning things, they can actually set items down on it, and their patient isn't getting contaminated, or their gown just isn't getting dirty from the things that we are doing. Once we've opened it, we're ready to put some solutions into our basin. So there's a big basin in here and a small basin. In the big basin, you're going to do 50% hydrogen peroxide and 50% sterile water. And again, remember, these are only good for 24 hours. They should be date, times, and initial. If they've already been opened, you should be lifting them in the garbage can. So 50-50 in the big basin and all sterile water in the small basin. This is for a trach that has an inner cannula that needs to come out, be washed, and be put back in. Okay? So we've put those items on. You're also going to need another pair of disposable gloves. I didn't get them. I can take a few steps back. My gloves are up here on the wall. I haven't turned my back on my sterile field. It's still in my view. Remember, all these sterile items need to stay above the waist. I am going to move this, and I'm going to pull out my inner cannula. Now, again, if I had forgotten to take that dressing out, I could do that now as well, and that would be fine. I'm going to stabilize the faceplate with one hand. You see my hand here. I know it's not a really great view of him. Hopefully you can zoom in a little bit on your end. Stabilize it, grab a hold of the end of the trach, pull it out. And as you're pulling it out, you need to twist it from like the 6 o'clock position on the clock up to the 3 o'clock or the 9 o'clock position. You don't want this to touch your patient's gown or get contaminated. Yes, it's dirty because it has secretions on it, but it's dirty with your patient's own secretions. We don't want to bring in any new microorganisms to this field. Okay, we're going to go ahead and drop that in the 50-50 solution. If your patient needs a high amount of oxygen, has trouble oxygenating without oxygen, you can go ahead and put their oxygen back on them during this time. Okay, we're going to take off our disposable gloves. Now, again, as I've already said a few times, ideally we wash our hands, but you have a sterile field set up in front of you that you really shouldn't turn your back on. So if you can, without turning your back on your sterile field, get to some hand sanitizer or to a sink, go ahead and wash your hands. If you can't, we'll proceed with putting on then our sterile gloves. In here, it's going to be a little tricky. You can see your sterile gloves are just kind of bunched up. You're going to need to take some care to note, like, what is the cuff in here, and how do I get these separated without contaminating the gloves and the items in there. So I just jiggled it a little bit. That other glove then fell off. So I can get my first sterile glove on here. Again, we want you working through these. This is what it's going to be like in practice. Now your hand is sterile, so you can reach in there a little bit more. You can manipulate that glove, getting it turned around so you can get the cuff up underneath, right? Just like we do up underneath our already sterile gloved hand, and put that second glove on. Now we want to focus on cleaning that inner cannula. This is the part that's actually the most sterile out of all of it. Yes, it's contaminated with your patient's own germs, but we're not introducing other microorganisms. So what's in here is sterile. You're going to pull out your wire brush, and you're going to gently move it through the trach, just getting out any secretions. This is also why we wear a face mask during this. There's some spray back when you're doing this. You want to make sure it's nice and clean. You can even use the brush up and down the edge. This front part is often where there's dried secretions. So you really want to get in there and get that clean. Okay? Doesn't matter really what you do with this. You can set it down on your table. You can throw it out in the garbage can, but you can't put your sterile gloves below your waist. You can just set it even back in that basin. Okay? Once we've done that, then we are going to, so we've cleaned it with that 50-50 solution, and then we're going to put it into the sterile saline or sterile water and just rinse it. So now I'm going in that little basin there. I'm just kind of rinsing it. You see I'm just kind of picking some up. And then you can just tap it off to get any, you don't want a whole bunch of water going in your patient. Yes, it's going to be moistened on the outside. You can easily put it back in, but it's not full of water, and your patient's not going to get a whole bunch of water or 50-50 solution or saline into their respiratory tract. Now we're ready to put it back in. Okay, both of our hands are still sterile to the patient. One hand now is going to stabilize the faceplate and or move the oxygen off the trach if need be, and the other hand is going to go. Remember, we're starting really at that kind of 3 o'clock position, and as we work it into the patient, the trach naturally slips down to the 6 o'clock position on the clock, and you snap it into place. You make sure that it's locked. At this point, the sterile portion is really over. Again, though, we're not touching a whole bunch of other stuff and then going to clean around it, but the sterile piece of it is pretty well situated. What we want to do next really is clean around the trach. So now you have other things in here like cotton tipped applicators. You have this split gauze that's in there. You're going to save that for the end. You have then some other, and I can use both hands here. There's some 4x4s. So you can take these into the sterile saline or sterile water, and just really like you're cleaning around the faceplate, you're cleaning under the faceplate. There's oftentimes a whole bunch of dried secretions. You don't want to contaminate it all around, so kind of pick one area, then choose a new tool to clean with. You can take this and even dip it down into the saline and really clean on that as well. Remembering to stabilize that faceplate if you're being, somewhat aggressive. If that's a brand new fresh wound, then of course we're going to be more careful because it's going to cause discomfort to the patient. Once you're satisfied with how it looks around there, you might even dry a little bit if it's pretty damp. You can take one of these other dry 4x4s in there and dry around it. We are then really ready to put this split gauze back up underneath the trach. So it takes a little bit of maneuvering. You don't want to pull the trach too far away from the patient, but you have to kind of slip it up underneath and feed it through. You guys can practice with this in the lab. I'm sure you can't see me all that awfully good doing this, but you work to get it underneath there and around the patient's trach so that that site stays as dry the best as we can. The last thing that you're then going to do is change the trach holder. Two things to consider here. If you're the only nurse in the room with the patient, you have to make sure that you put the new trach holder on before you take the old trach holder off. So you would put it around your patient, the back of their head. There's little Velcro tabs here that you feed up through the trach. You make sure it's tight enough that you still can, that it's not going to fall out, yet not too tight that you can get a finger or two in between the trach holder and the neck. Once you have the second one secured on there, then you can remove the first one. Your comp scenario will tell you if you're the only nurse or if you have a nurse. If you have another nurse at the bedside, which will ultimately be your instructor, they can hold the trach for you, and you can take the old trach dressing off, the trach ties off, and then put the new trach ties on. But you can only do that if you have someone to hold and stabilize the trach while you do it, because one cough and that whole trach can come right out. Okay, so let's think about what this would look like if we had a cannula that was disposable. So when we have a disposable cannula, you'll see on your trach sheet, really up until number 9 is the same. And so at that point, when you're opening your Trach Care kit, you're pulling your basin out, you can skip down to step 17. And why is it different at that point is you only need sterile saline in your basin. It really doesn't matter like which basin you put it in. The sterile saline's only to clean around the trach, because all you're going to do is pull the disposable cannula out, throw it away, and open another one. So in this case is where you're going to need this additional component, which is the additional disposable inner cannula. I am going to get my sterile gloves back. Just a few more pieces that I want to have. So remember that all of this is in your kit. I'll fold it up. So this is like a brand new kit in there. I've pulled it out. I've poured my sterile saline or my sterile water in there. And now I want to open up this disposable inner cannula. You can place it right in with your other sterile items, or really honestly, the best thing to do is just leave it right in this package. Remember, we're not reaching over this stuff once it's set up, and we're really getting ready to go. I'm going to now put on some disposable gloves, remembering not to turn my back on my sterile field. And the reason why I'm putting on sterile gloves here is that I still need to remove that inner cannula. So I'm going to put on, disposable or clean gloves. I think I said sterile. Disposable, clean gloves. I'm going to come over to my patient. They should still have oxygen on them. And put the oxygen to the side. I'm going to pull out, again, stabilizing the faceplate. I'm going to pull out that disposable or inner cannula, and that really just gets thrown away. It's disposable. That's the point of it. Makes it really nice and easy for nurses to do this. If I can, wash my hands. If I can't, without compromising my sterile items here, then I want to make sure that I don't turn my back on my sterile field. Now If that dressing was still under there, I hadn't taken it out previously, I could take that out now as well. And then I can go forward and put my sterile gloves on. So of course I've already had these on, but they would be in the kit in the same fashion. You put your sterile gloves on, and now you can pick up this sterile new inner cannula and work that into the patient. You can lubricate it a little bit with some water. You have a sterile basin here, your hands are sterile. If there's any reason you can't lubricate it a little bit to get it to slide more easily into the patient. Make sure it's in there, it locks, it stays in there. Again, if your patient needs oxygen during this time, go ahead and place the oxygen on the patient. You only really need the sterile gloves here to put that inner cannula in. You can keep your sterile gloves on now, but the whole purpose is just that for them to be clean at this point. You're going to take your Q-tips, you're going to clean around it just like we did in the other scenarios. So really what the difference is we don't pull that inner cannula out. We don't put it in a 50-50% mixture of hydrogen peroxide and water or sterile saline and put it back in. We take it out, we throw it away, we put our sterile gloves on, we grab our new disposable sterile inner cannula, we put it in, then we clean around the outside just the same, we clean around the trach ties just the same, and change the trach ties exactly the same as well. Okay. Remember, there might be some demos coming up. So if you're interested in seeing this in person, make sure you look out for demos if there's some scheduled.